These are working. All right. So good afternoon, everyone. Thank you to Matt Brown, who's in the back working our audio today, and to Shannon Kirby, who will be running our PowerPoint. So welcome to the Bucks County Human Services Block Grant hearing on May 15th at 12:30. We're glad that everyone's decided to join us. Thank you for signing in at the back. And then I want to acknowledge that we do have people online. I'm not sure that we can see them here, but we do have people joining online. And it would be great that for those joining online, please feel free to go ahead and enter your name, email, and what organization you're affiliated with. So if you're able to do that online, and Shannon, can you confirm that we're able to see that? Great. Okay. Good. So my name is Rachel Neff, and I'm the Director of Human Services here at Bucks County. And we are going to be spending the next hour or so talking about a number of initiatives and programs that are happening throughout the county where we utilize the Human Services Block Grant for. But first of all, the good news is there's a panel discussion today. And so I want to introduce who's here. First and foremost, we have an excellent partner in the Bucks County Opportunity Council, and so Erin Lucas, the Executive Director with BCOC, is here today, and we're glad that she's here. We also have Diane Rosati, who is the Executive Director of our Drug and Alcohol Commission, and we'll be hearing a lot of good information from Diane about how the block grant supports the work at the Commission. We also have Donna Duffy-Bell, who is our Administrator for Behavioral Health and Developmental Programs, who's going to be doing a significant portion of the presentation today. And joining us online, who we in the room cannot see, but Beth McNamara from Comans, another one of our valued partners, is online and should be presenting as well. And when it is her turn to present, we'll be able to pull her up so you can see her. So we're gonna, again, and anyone joining online, please enter your name, contact information, and then moving to the next slide, I just want to review our agenda for today, and the introductions pretty much summed up who you're going to be hearing from, and then this outlines the respective departments that are going to be represented in the conversation today. I wanted to share that I believe this is the 11th year of the Human Services Block Grant for the state of Pennsylvania. And we are required per the Human Services Block Grant to hold these public hearings. So we have one today, that's the hybrid, in-person and virtual, and then we have another one on June 1st. People are welcome to join that as well. And we do want to make sure that we have an opportunity for public comment in these hearings. So as you're coming into the space today, if there's anything individuals would like to say now, we're willing to hear that comment, and if you're online, you can indicate that in the chat. Or I want to point out as we move through the agenda, after you hear from us about the block grant and our Human Services Development Fund, the HAP program, our Behavioral Health and Developmental Programs initiatives, and drug and alcohol initiatives, we will have an opportunity for public comment at the end as well. So people are welcome to respond to what they hear today or share comments that can help inform us as we submit this block grant to the state later this summer. Okay, so just want to pause for a moment. Is there anything in terms of the room that anyone would like to share now, or you're welcome to hold till the end? Okay. Fair enough. And I just want to check, I think everything's okay with the PowerPoint moving along. Okay, great, I saw a flash once or twice, but as long as everyone online can see it. So we're gonna move on. The next slide, just reminding everyone, again, this is our Human Services Division, and the vision is a vision in which all individuals and families can thrive in our community. And our mission is to support and strengthen individual and family wellness through community connections, collaboration, integration, innovation, and responsible stewardship of resources. And on the next slide, I want to highlight that piece about community connections and partnerships, This screen really reflects so many of our valued partners that we work with all year long in carrying out our mission here in Human Services. And we're grateful for these partnerships. And just even in the last couple of weeks alone, when I think about, we had the CSP picnic hosted, we had Prevention Day hosted at the county that brought together a number of partners. We've had the Bucks County Health Improvement Partnership event representing our partnership with hospitals. We've had events with law enforcement. So we really do recognize that partnerships really make our work possible. So thank you to all those partners and for those of you who showed up today and online. In the next slide, I wanted to highlight something that I think everyone knows, but really just want to reiterate. Our block grant that we've been receiving now for 11 years really allows us flexibility in how we fund various initiatives. While there are core programming components that we have to carry out, we do have some flexibility in how we spend those funds. And I think that that's really a benefit to counties, and Bucks was one of the first 20 counties to be a block grant county back in FY 12 and 13. And I think that we've taken advantage of that opportunity for how we decide to craft program here to best meet our community needs. On the next slide, and this is just such it's a small but critical portion of the block grant. One of the things that we're able to do through the Human Services Development Fund portion of it, which is approximately $400,000, is really work with organizations who provide some type of specialized support or need for the community that's not otherwise met in some of the key or larger initiatives that we'll be hearing about throughout the presentation today. So just as an example, we wanted to show, and this is reporting that we did for our numbers for this year are being finalized, but in FY 21-22, so Advocates for the Homeless and Those in Need, this is a small grant, but we provide to AHTN to make sure that individuals who are experiencing some type of housing instability or experiencing homelessness have a place to actually go to during Code Blue, get basic needs met, get transportation to where they need to be. Another example, through Family Services Association, and I see Julie Dees is in the audience, we support them with their intake and referral services. Again, people need to know where to turn for supports in our county, and we have to make sure that services are accessible. So FSA is one of the organizations that helps supports us with sharing information. Liberté is another one on here, helping individuals who are in recovery, women who are in recovery from substance use disorder, getting services and supports and case management. So, and I know that Aaron is going to be talking about the HAP program with BCOC, but the Economic Self-Sufficiency Program is another fantastic initiative that our HSDF funds support. So this is just to give you an understanding of some of the organizations we support with HSDF, with that flexibility. And then in the next slide, one of the opportunities, again, that we have with the block grant in deciding what types of services we want to provide in the county, we decided about a year or so ago to bring on a community engagement officer position, and that position has been partially funded through the block grant, and really helped us bring to life and develop some initiatives that were newer to the county. So I came last year and shared with you that the Bucks County Human Services Hub launched in 2021. We're now over 2 years in opening because we opened in February of 21, and we've seen significant outreach to the hub, and that the hub is very involved in providing supports and information to our community. So our community engagement officer supports this initiative, as well as a human services coordinator in the hub and a resource navigator. And this is just some of the some snapshots in terms of why people are reaching out for support to our hub. And the next slide, along the lines of flexibility, several years ago, we piloted a program with some funding from the block grant The program has since evolved and developed, but our Human Services Co-Responder program was piloted in Bensalem, starting with 2 individuals who were co-responders, and we were able to see the impact of that pilot program and decided to expand it. So we went from 2020 with 1 police department, and I'm happy to announce that next month we'll be in 18 police departments. So again, just reflecting how we've been taking advantage of some of the flexibility with the block grant and some of the initiatives that it has allowed us to launch in Bucks County. And I think this slide just shares some of the goals of that program, which is really to decrease the amount of time law enforcement spends on social service types of calls, and how we divert individuals who come into contact with the criminal justice system from further penetration into the criminal justice system. And we want to make sure that we're connecting people and streamlining them to resources. So on our next slide, I'm going to be turning it over to Aaron Lucas to talk about our homeless assistance program. And I just kind of wanted to close out my opening comments by saying, while we have a number of fantastic partners and providers, we also have a team here at the county who I'm really fortunate to work with, and we have hundreds of staff in our Human Services division who do just a phenomenal job every single day. So I want to recognize their work, and I appreciate their work. And now I'm going to move it over to Aaron to talk about HAP.
That sounded so loud. Is it loud? Yeah? Okay. All right. Hello, everyone. I'm Erin Lucas. I'm the Executive Director and CEO of the Bucks County Opportunity Council. BCOC is the community action agency for Bucks. We are a nonprofit 501c3, but we're the designated organization that works with people in poverty. And we oversee the HAP program for the county, well, a portion of the HAP program for the county. Our mission is to reduce poverty and partner with the community to promote economic self-sufficiency. We have approximately 60-ish staff in 5 locations throughout the county. We have 2 food distribution sites, 1 in Doylestown and 1 in Bristol. And our agency budget's about $11 million, roughly $500,000 is from the block grant for homeless services and case management. Next slide. So a little bit about HAP. And I'm gonna read this because I don't have it memorized after 20 years, but HAP, the definition of HAP is that it helps to assure that homelessness can be avoided, people who are homeless can find refuge and care, and homeless and near homeless clients are assisted in moving towards self-sufficiency. Other than being a resident of the county, there's really one rule to receive HAP funding. It is that people must be able to pay future rent. So they have to have the ability to maintain in order to receive assistance. And there are 4 components to the HAP program. One is the housing link, one is case management, rental assistance, and bridge housing. So next, I'm just going to talk a little bit about the housing link. That is centralized intake and coordinated assessment for all housing-related crises in Bucks County. It is a collaborative approach to helping people resource and resolve their housing issues, as well as eliminate duplication of services and streamline access to shelter services. This past year, we helped nearly 1,400 households were served through the Housing Link housing planning portion. That's the portion that BCOC serves. We operate 3 housing resource centers, 1 located in Quakertown, 1 in Doylestown, and 1 in Bristol, and a satellite office in Warminster. And funding for the Housing Link comes from a variety of sources, including HUD, PHFA, CSBG, and the Human Services Block Grant. I just wanted to add that Housing Link, while BCOC handles the portion that is housing planning when people are, they make a call to the call center, Family Service operates the call center, we then handle the portion, people are referred to us, and then we help them kind of address their issue, work through their problem of housing or homelessness. and then refer them to other housing resources in the county. I think something important to note is that this past year, the county also assisted nearly 2,600 households with the Bucks County Emergency Rental Assistance Program, the BERA program. And that was, we hope that we will have that assistance for at least another year or so, but it has definitely helped people not become homeless during this past year, which has helped the HAP funds go a little further. So, next slide, Jen. A component of case management is that it's really designed to coach, guide, and assist families in identifying solutions and strategies to resolve their housing situation, or to work on more long-term goals towards self-sufficiency through our economic self-sufficiency program. Services offered under case management include budgeting, landlord negotiation, employment assistance, and referral to community services. This past year, with the case management portion of HAP, we've assisted 168 households so far. The next component is rental assistance, and that really is to assist people who are facing homelessness. They're facing eviction, that's you, addiction, yeah. They're facing eviction or are currently homeless. It's limited funding, but we are able to braid that funding with other funding sources so that we can help prevent someone from being homeless. The assistance is limited to $1,000 for individuals without children under 18 and $1,500 for families with children under 18. And those amounts are available once in a 24-month period. So to date, we have assisted 376 households with HAP funding. And I think something important to note this year is that we actually exhausted the HAP funding that was available through the block grant in March of this year. But the county was able to provide additional support of $100,000 through the housing department of the county. So that will help us, really help at least an additional 100 households, which, you know, it's nice to not have to tell people, no, we're out of funding. The next slide. The last component that I'm going to talk about is the Bridge Housing Program. And Bridge is a transitional housing program designed to help homeless or unstably housed families connect with permanent housing. And it is paired with intensive case management services. We serve about 10 to 15 households at a time. It is rolling, so as families graduate the program, new families come in. And the case management is provided, it's in a partnership, it's through Children and Youth, while the rent is paid through the HAP program. And participants in this program are given housing and comprehensive case management for 6 to 18 months. These days, people are staying in the program 18 months, and then sometimes we're having to flip them into another program due to housing affordability issues in our county. Both the Opportunity Council and the Bucks County Housing Group provide the case management for that program. Eligibility for the Bridge program includes involvement with children and youth. All referrals come through the county's Children and Youth Department. People need to be under 200%, have a housing crisis, and be a Bucks County resident. Any questions? Or we're moving to?
Nope, I think we can move on.
You're
Good afternoon, everyone. I'm Diane Rosati, Director of Bucks County Drug and Alcohol Commission. It's great to see you here today and to know that there are folks that are online as well. I'm going to share with you a little bit of information about the Bucks County Drug and Alcohol Commission, the block grant, and the impact on the community. And I hope to wrap up briefly with a few comments about the opioid settlement, because I know we've received some interest in that topic as well. So the Bucks County Drug and Alcohol Commission is a private nonprofit agency. We serve as partners within the Division of Human Services, though. We are a 501c3, as I said, a nonprofit agency. We have two offices. We have the office in this building. We're on the floor, happily co-located with behavioral health developmental programs and the other human service departments who are in the building. We have about 20 staff on the fourth floor here, and about 7 staff who are located at the jail because, as everyone knows, The vast majority of folks who are at the correctional facility have some issue relating to substance use or substance use disorder. So we have 7 staff who are located there as well. We're overseen by a governing board of directors that meets every other month. Our meetings are public. The public is invited, and you're welcome certainly to attend. We have an executive committee and a remainder of our board. We have 11 members who are all residents of Bucks County, and for so many reasons have a commitment to the issue of substance use. Next slide, Shannon. Thank you. So I'm just going to briefly run through these items. The Drug and Alcohol Commission's portion of the Human Service Block Grant is just under $2 million. And to give you some context, that's an important slice of our budget, though our budget total is fairly fluid, especially with some additional funds we're receiving, but it's about $9 million overall. The Human Service Block Grant funds are funded primarily toward areas of recovery supports and treatment. And I wanted to just run through with you just so you get a sense of the areas. So first, detoxification. As you know, we want to make sure that residents have access to health services. And so if someone is in need of detox services, we want to make sure that they are medically cleared and can then continue in the next level of support, which potentially could be a rehab support. Our philosophy, though, is to ensure that residents have as many episodes of care as they require, not just 1, not just 2, no artificial number, can remain in treatment for as long as they would like to remain in treatment and as long as they're progressing and what's called medical necessity criteria are progressing along that continuum. But often residents have to start with detox, and it is so common, especially given opiate use, that residents have multiple detox experiences. But we move toward rehab services, outpatient, intensive outpatient, and partial services. We have a focus that's specifically tied to science, of course, and that is medication-assisted treatment. We know that opiate use is very, very challenging to overcome. Many residents, some would think most residents, require medications like we would need medications for other medical issues, and so we completely support the use of medications that you may have heard of, like methadone and Vivitrol and Suboxone are just some examples of medications that we encourage the use of. We're funding not just the medication, though, but also the treatment that accompanies the individual, so that we're sure that they get a really comprehensive look and as much support as they might need. And finally, there is a significant number, if you can see, which is over 1,500 residents over the last year who've been able to receive funding through the block grant for recovery supports. That includes perhaps peer support, recovery housing, case management, specific program that would focus on outreach to residents. There are many residents in our community that aren't quite ready for treatment, and many families who need support because of that. So we have services called mobile engagement services through one of our providers that's a very active and vibrant program that's frankly expanding throughout the county to ensure that residents have access to all services. So that's mobile engagement services, and that's a very large category of recovery supports. In terms of forward motion or things that we're looking to do, clearly one of our top priorities is to reduce substance use as well as to reduce non-fatal as well as fatal overdose, and that remains a priority for all of us. I'm brief in my remarks, but I don't want to leave without reminding everybody. Our prevention supervisor, Mallory Parati, is here, and I know that she would say the same, which is we want to make sure that every one of you, all of our residents, know that we have Narcan at no cost, available to you, available to your agencies, available in the community for anyone who is in Bucks County, so please don't hesitate. It's available at no cost. We want to continue to ensure our prevention programs continue, and we provide evidence-based prevention programs. We are growing our programs, as you can see, to ensure that what is working is expanded upon and that we continue to do those programs. We're focusing on recovery housing in our community. Specifically, we're focusing on some female recovery housing, but recovery housing overall, because we know that it is extremely challenging for residents who are in the community trying to overcome a substance use issue and for so many reasons can't return home or didn't have a home to return to and need some ongoing support. So we'll make sure that we continue to do that. Expanding all of the communities that we're working with, and a focus on the education of our communities through the expansion of what I think you'll see is our refreshed website, which is going to be occurring shortly. Finally, opioid settlement funds are an important topic. Everyone is aware, I believe, that Bucks County has already received the first drop of funds through a multi-year, an 18-year settlement. The first settlement is roughly a $45 million settlement, and so the county has already received about $4 million and is in the bank account ready to be spent. Some of the projects have begun already. Commissioner Harvey appointed an opioid advisory committee about a year ago. That committee met and received a lot of community input into a plan, and the plan was approved by the county commissioners. It's a comprehensive plan that includes prevention and treatment and recovery supports and administration of the project. We have an email account, OAC, as in Opioid Advisory Committee, oac@buckscounty.org. If you have ideas or if you know residents who have ideas on how to expend the funds going forward, you haven't missed an opportunity. So there will be a mini grant opportunity available to the community, which will be coming out very shortly, where community partnerships and groups who've not had access to funds, for example, will be able to apply for mini grants that could be roughly $20,000 or so. So we will be expanding the opioid settlement project in the coming months, and we're really excited about launching some new projects. The county website does hold the plan, and if you're interested in seeing that, you certainly can see that, and I will be able to share that with you at any time as well. So it's an extremely transparent process. Again, any feedback, please share on OAC at buckscounty.org. So that's a bit of information about the Bucks County Drug and Alcohol Commission and our services. We provide prevention, intervention, treatment, and recovery supports, and our website mantra is we're here to help, and that's really what we're here to do. So going forward, if you have any questions at all, happy to take your questions or ask you to refer residents to us. Thank you.
Great. Thanks, Diane, for that presentation. And again, I know both Aaron Lucas and Diane Rosati have just shared a lot of information, and there will be an opportunity at the conclusion of Donna's remarks and Co-Man's remarks for public comment or questions. So next is Donna, and I just wanted to confirm we do have the other presenter online, correct? Okay, and you'll pass to her when you're finished, Donna?
Okay,
Okay,
sounds good.
thank you.
Thank you. As Rachel said, I'm Donna Duffy. I'm the Administrator for Behavioral Health and Developmental Programs. My department is what we call an administrative entity, so we do not provide any services directly, but rather fund organizations and entities to provide services on our behalf. So as Diane said, we're co-located on the 4th floor of this administration building, and we employ about 55 staff to provide that oversight to both mental health and developmental programs. Okay, first slide, Shannon. I always like to give a little bit of demographics. We, in behavioral health and developmental programs, do receive the lion's share of the Human Services Block Grant. So for fiscal year 22-23, we have received about $31.7 million. In last year, we were able to serve about, you probably can't see the numbers there, but 4,470 individuals participated in mental health services. And I just want to point out that where there's public funding, it comes for mental health services, it comes from both the block grant, but then also medical assistance. So in those numbers served are not individuals who receive services through medical assistance. Medical assistance is definitely a significant player in terms of supporting individuals. And in 2022, medical assistance through the Health Choices Program, which is the managed care program of medical assistance, they supported about 17,000 individuals. So that gives you a sense of how many are supported through the block grant versus through medical assistance. That said, on the intellectual disability autism side of things, the 2,118 individuals supported last year represents both individuals supported through base funding, through the block grant funding, but also through medical assistance waivers, as our department is responsible for the oversight of those medical assistance waivers. You'll also see by the pie that the majority of funds within our department from what we receive from the block grant does go more to mental health services versus intellectual disability and autism services. So the green portion is mental health, purple is intellectual disability and autism. And the main reason for that disparity is that on the intellectual disability autism side, individuals who need housing and supported housing are supported largely, mostly, through the medical assistance waivers, so they don't need block grant funding for that support. On the mental health side, it's the opposite. The majority of all supported housing and different levels of housing support comes from the block grant and not from managed medical assistance. Next slide. I'll spend a little bit of time on the intellectual disability autism system to talk about early identification. As with any issue, human service issue, obviously if you're able to identify individuals at risk early on and provide early intervention, you have a much better chance at better outcomes. So we try to do this in the intellectual disability autism side through two main ways. First, each year we're lucky to receive a little bit extra in terms of capacity for serving individuals through the medical assistance waivers. And the past year and this year going forward, we are trying to target those they're called slots, unfortunately. We're trying to target that waiver capacity to younger registrants so that we're focusing on services that are more preventative and, again, early identification. In addition, this month, we are adding a position to our department, which is an outreach and community engagement specialist who will engage more with the schools, with the community, and work directly with families around identification of kids so that we can, again, bring kids in and provide supportive services so that in the long run, we are diverting people from, like, for example, congregate settings and really intensive services. Okay, last year we talked about incident management, and I just have this slide here for intellectual disability and autism because we had a new state bulletin last year. We thought there might be significant impact from that bulletin in terms of the number of incidents that would have to be reported and how much we as an administrative entity would have to investigate those incidents. So we do have now a year of tracking, and we are seeing, so far this year, we are seeing about a 9% increase in the total number of incidents and about an 8% increase in those which have to be investigated by our department. So that was just really an update on that. We, as an administrative entity, are responsible for investigating certain categories of incidents. Other incidents are investigations are completed by the providers with whom the individual is in service. But for certain things like exploitation of funds or abuse and neglect, those would be investigated by our department. Okay. Next slide. So moving to mental health services, again, focus on prevention. There's a couple of different things I hope to highlight. The first is under children's services initiatives. We have some new things going on this year and some things that we are continuing. Family First was a children's initiative we talked about last year. That continues to evolve in terms of looking at children who are in geographic parts of our county where children are more involved in the public welfare system and more at risk for out-of-home placement, and targeting, planning, and intervention around those areas. So that work continues in conjunction with Children and Youth and with the Human Services Division in general. In addition, we have the first episode psychosis program that is new this year. That was just awarded in July of 2022. I see Brian Luke here from Child and Family Services. Child and Family Services is our provider for that program that, again, targets individuals who are having their first episode of psychosis, so targets individuals aged 15 to 30. It's a team-based approach, again, targeted to provide assessment, early referral to supports, focus on recovery, focus on employment, and really improving the everyday lives of individuals who are experiencing their first episode of psychosis. CIT, Crisis Intervention Training, continues. We trained an additional 59 law enforcement personnel this year. We have a crisis intervention trained officer in every department, police department in Bucks County at this point, with most of our departments having more than 20% of their officers trained in CIT. We also started this year something for non-law enforcement personnel, which brings in some of our suicide awareness training, our mental health first aid training, focus on peer support. So it focuses on some of the pieces of CIT, but is targeting non-law enforcement. Okay, next slide, please. This just gives you, our two main community trainings, which we do out of the mental health unit. Again, our questions, persuade, and refer. The suicide awareness training, that's a 2-hour course. That's for anybody in the community is able to take that course. If you're interested in your organization or community group having a training, please reach out to our department. For that, Wendy Flanagan is our staff person who leads question, persuade, and refer, as well as mental health first aid. Mental health first aid is done for both adults and for intervening with both adults and children. That's a little bit longer course. That is an 8-hour, course. As you can see, if you compare the different years, there's been a significant increase, we've done some additional trainings, but what has really increased is the number of people who have been trained between, you can see 2021 there, and then the big jump to 2022 in that middle column. And that really is a function, not only, I think, of greater interest in being trained, but also during the pandemic, we started to offer a virtual option for training. So now we do a combination of face-to-face, in person or virtual trainings. And I think that really has made the training more accessible to many more people. And that's contributing to that big spike in community trainings. Okay, next slide. Forensic system, this is a huge focus of our mental health funds. I listed some current initiatives there because we talked about them last year and just wanted to, give a brief update on some of them. For example, the first one under current initiatives is Mental Health Court, that has had 14 individuals participate in that court to date. That has an affiliated wellness house for men, so men live there for up to 2 years. That house as well has seen 14 individuals from mental health court and or the co-occurring substance use mental health track of drug court reside in that house. We talked about assisted outpatient treatment last year. We implemented that in August of 2022. And to date, we've actually only received 13 referrals for that program with only 1 petition moving forward. So we continue to assess the meaningfulness of that initiative. That was an initiative that no county in Pennsylvania had signed on to do. But the state had provided some grant funding as an incentive, for counties to try out to see if this helped be a lower level involuntary commitment to folks to outpatient treatment versus inpatient treatment. So it's an involuntary commitment to outpatient treatment. But there's a lot of flaws in the legislation and the criteria for this program, which the counties had previously pointed out. But when the state offered monies to test it out, we thought, we in Bucks would like to be one of the pilot programs. So we are one of 3 pilots. Dauphin County is also piloting it, as well as Carbon Monroe Pike. We're the only pilot county to even have 1 petition move forward to date. So again, we'll continue to evaluate that, but I just wanted to provide a brief update where we were with that. Rachel talked about the co-responders already. And then the Stepping Up initiative, which is a full county initiative, but our department provides the Stepping Up liaison to the state. We were just awarded recognition as an innovator county. So based on our efforts around diversion and reentry, so that just happened, I'm gonna say about a month ago. So that's, that's a pretty big deal, and we will, we're looked upon then to do presentations across the state, to help consult with other counties in improving their diversion and reentry services. So that was a nice acknowledgement from the state. Things in development, folks, if they've listened to previous block grant hearings, I keep hearing about the forensic diversion and treatment center. That does continue to evolve. The demolition of the structure on county ground in Bucks County has been completed. The asbestos mitigation has been completed. At this point, we are awaiting response to an RFP for construction. So once the construction begins, it will be about another 12 to 18 months to actual implementation. In addition, after my remarks, you're going to hear from Comans, which is our provider for a women's wellness house. Again, this wellness house will be primarily affiliated with the mental health court, but will also be available to women who are forensically involved, who need that 24/7 level of support to prevent recidivism, to become stronger in their recovery and in their progress. So those are the new things. I always like to provide this slide. You know, I said 31.7 million come to our department for mental health and intellectual disabilities services. And then, you know, the lion's share of that, about 21.6, comes to mental health, million comes to mental health. About 50 to 55% of the money that comes to mental health, again, is used for housing, for supported housing. So this, I'm assuming, you know, slides would be available upon request, but I'm not going to go through all of this slide, but it just lists the different types of housing to which we provide funding, and they differ in terms of the level of support that is provided to individuals. Next slide. Okay. Some new things which I already, in terms of housing and residential services, which I already touched on a little bit, we were able to add 7 quote-unquote slots to our housing capacity. At any given time, we have the capacity to serve 305 individuals. We supported 357 last fiscal year in our housing programs, but we were able to add 7 additional slots for increased capacity to supported housing. Again, the Women's Wellness House will be new. Reach Out Foundation, who we have previously contracted with in the community, also opened a drop-in center this past year. We call it a day shelter for individuals who are homeless, who also have mental health challenges or mental health and co-occurring substance use challenges. It's a place to come and get some hot meals, to get a shower, to wash clothes. That has been a great addition to our whole county system in terms of supporting individuals who are homeless. I'm not going to go over the capital development project. You know, we talked about that in previous years. That's being fully utilized in Sellersville. We continue with our landlord recruitment. We increased our personal care boarding home capacity, and we continue with our Housing First initiative, which again, that is through Family Services. As Diane said, Julie Dees is here from Family Services. It's not only money for housing, but it's also case management for targeted case management for individuals who are homeless to help stabilize individuals, because as we know, housing is actually the #1 predictor of mental health for individuals. Okay, next slide. Crisis services, which is also something I like to talk about. Again, the majority on the mental health side of funds is spent on housing, but crisis services is also a large area where we devote funding. Since the pandemic, there's been a lot of press, a lot of awareness about the impact that the pandemic has had on behavioral health. So we look at our crisis services, we look at the volume that's coming to our crisis services, and also number of individuals served. So again, we are seeing, and again, this is just a comparison of total last year is the red bar. The lavender bar is just January through March of this year. So that's only 3 months. So if we continue with this trend, we are seeing about a 10% increase in the number of crisis events. So individuals calling, presenting at an identified crisis center, mobile crisis going out to see someone. We've had about a 10% increase in crisis events, and again, an 8% increase in the number of individuals, unduplicated individuals who are presenting. I did want to do a call out about 988. That was also implemented in July of last year. We talked about that. Family Services, again, is our regional 988 center. So they are covering not only Bucks County, but 8 additional counties have been assigned to them to receive crisis calls utilizing that 988 number, which is meant to be a quick, something that people can easily remember. And it's not just for individuals who are feeling suicidal. It's also been expanded to also offer some brief crisis counseling. So it really is another alternative to crisis intervention. So we're tracking calls there. I will say that the pandemic not only gutted staffing in our housing programs, but also in our crisis services. They were the 2 services most dramatically impacted by the pandemic. We're still working through that. So again, when you look at volume of things, sometimes it can be a little misleading, because is volume really down, or is our capacity to respond down? So we're seeing sometimes some lower numbers in some areas. So it will be interesting to see, once workforce restabilizes, where we are in terms of crisis response. Okay, next slide. Okay, again, looking at inpatient hospitalization, we hear about individuals sitting in emergency rooms and boarding, and is that really because there's been an increased volume of individuals going to inpatient, or is it more a function of our system not being able to admit individuals? So we do track individuals who are going into acute inpatient behavioral health hospitalization. And that also, we should play these numbers in the lottery maybe, I don't know. I can't say that next to Diane though. But that also, we're seeing, if we trend, and again, we've only had, through March, January through March, but if we continue with the trend we're seeing, again, that's about an 8 to 10% increase in individuals going into inpatient hospitalization. Next slide. Involuntary commitments, we also track trends in that in terms of number of petitions that we receive, which is the first bar. Again, we're only reflecting January to March in that second set of columns there. And then we also track, of those petitions that we receive, how many are approved by our county delegates, which operate out of my department, how many are approved by physicians, which is the second level of approval after the delegate, and how many are denied. So we actually are not seeing any difference in trends from last year to this year in terms of involuntary commitments. It's very close if the trend for January to March continues. Next slide. Okay, so in terms of what's new with crisis, we're very excited about the planning with our Drug and Alcohol Commission and with Doylestown Hospital around the development of a new crisis assessment and stabilization center. This will be located on land that Doylestown Hospital will be leasing to Lenape Valley Foundation to provide the services. It will be an integrated assessment and stabilization center, meaning that it will be competent both in handling assessment for mental health crises as well as drug and alcohol assessments. And then we'll also be able to provide brief stabilization with the goal of starting treatment immediately and alleviating some of this emergency department boarding where people are waiting for certain levels of care, especially on the mental health side. They wait for care without active treatment starting. So the hope is that if we able to start treatment right away, you know, there might be a significant number of individuals who we can just stabilize in this center and really not need to refer for inpatient hospitalization. On the drug and alcohol side, things like withdrawal management would also be managed in this center. It would be for both youth and adults. The funding for it is quite braided. Diane mentioned opioid settlement monies, so some of those will be utilized. There have been grants from both at the state level, from both the Office of Mental Health and Substance Abuse Services, as well as the Department of Drug and Alcohol Programs, DDAP. There are the counties also leaning in with some AARP, or not, ARP funding, not the over 60, not the over 60 funding. So again, a lot of braiding of funding, a lot of stakeholder involvement from the hospital, from the community, from family members, you know, working on the development of that center. So again, it's in the preliminary stages, you know, in terms of engineering and architects, you know, taking a look at things. So that will also be a center that's down the road, you know, will not be completed in this fiscal year, but just putting that on your radar. So that concludes my comments.
Great, thanks, Donna. We are going to move to Beth Ann McNamara at Comans. And this is the exciting part where we test the technology and see if we can bring her up. Is that the plan, Shannon and Matt? Okay. So as Donna mentioned, Comans is supporting our wellness houses. They provide a number of services for the Behavioral Health and Developmental Programs Department, and I am happy to turn it over whenever she's on, Shannon. Beth Ann, can you hear us? Oh, we can see her. We'll work this through. Oh, good. We have an IT staff member on hand. So if you don't mind just bearing with us one moment, we hope to have you. We can see you. I don't think we can hear you yet. So we're going to get that sorted out. Okay. Thank you. I know. Let's hope. Okay, do you want to try saying hello, Beth Ann? Do you try again? Is she unmuted? See, I always believe there's going to be some small hiccup when it comes to technology. So we still can't hear you. Just to let you know, Beth Ann, because I'm sure we're going to get figured out. We have about, I think you can see us as the panelist, and there's about 10 to 12 individuals in the audience from several of our provider organizations and a few of our staff here at the county. So Shannon, if this doesn't work, is there a call-in number? Or we're going to try again? Do you advise she call in? And there's like different speakers. Okay. Again, thank you for bearing with us for a minute here. Exactly. Step out, use them. So Beth Ann, we're almost there. Matt Brown's going back to switch the speakers out, and it does sound like individuals online can hear you. We unfortunately just couldn't hear you in the large room here. So hang on one moment.
Hey Beth, can you try once more, please?
Sure. Can you hear me?
Yes.
Yeah? Great.
Great.
Fantastic.
Okay. Thank you, and
Well,
feel
good
free to take it
afternoon,
away.
I appreciate being here to, is everybody good? So I'm here on behalf of COMANS. I'm the executive director of COMANS. My name is Beth Ann McNamara. It's nice to follow Donna, who had given a really nice, as part of her presentation, the breakdown of some of the different housing in Bucks County. So COMANS is a private nonprofit 501(c), like many of the other organizations. What was unique about COMANS when I first became familiar with the agency is that we were what was considered the only free floating CRR program, Community Residential Rehab. For those, we love acronyms in this field. In Bucks County, which meant we were not attached to a base service unit such as Pendel Mental Health, Penn Foundation, Lenape Valley. So Pendel Mental Health is our base service unit, so we have always worked very closely with that agency. When I first started here as the director a long time ago, back in the 90s, it was a 14-bed facility on the fringe of losing a license. And I was brought in to put the program back together and expand the program. It was a sort of a condition of my position was that I would expand, not knowing all that much about housing or how you go about acquiring funding. I was fortunate enough to always have a nice relationship with the Bucks County Office of Behavioral Health and Developmental Programs. So over the course of the years, we have started with what was a community residential rehab program, which was a highly structured program under state licensure, to branching out into different supported living programs, which many of the organizations in Bucks County have. And I think each one of us as an agency runs them slightly different. Different levels of care, and which is one of the beautiful things about operating something that is considered supported housing, because it can be really individualized to those we serve and tweaked accordingly, because it gets away a little bit from the licensing programs. So these expansions that COMANS has done over the years, we have gone, since I have been director of the program, from 14 beds to 61 beds. And I will talk about our upcoming expansion. This has come in the form of when I first began with Comans, we were this small 14-bed facility in a landlord-driven, not very empathetic, landlord awareness, I know, is also one of the, goals of the county in being more accepting of our individuals. There's such a shortage of affordable housing everywhere, but particularly in Lower Bucks County. So we have I started soliciting funding we purchased our CRR building, and then I branched out and I wrote a grant to get HUD funding to open an 811 program. And just with that, I think Coman started developing a reputation of, they might actually know what they're doing. And our waiting lists were so long, and it was just waiting lists everywhere. So we continued to look for opportunity, and block grant funding has been integral in making that happen, as well as all of the individuals that work at the Department of Mental Health, Behavioral Health, and Developmental Programs. Always willing to be open to an idea, come to us and say, hey, listen, we need agencies to think outside the box. We need to decrease these waiting lists. What can you do? And I really enjoy hitting the pavement and looking for a property and seeing how we can actually serve some folks in it. So most recently, through block grant funds, we have been able to purchase 5 condos, a duplex, a single family home that was also in conjunction with community development block grant funding. I want to make sure that I, show my gratefulness towards them as well for our first try at independent living at a, old home in Morrisville that, without all of the collaboration within these Bucks County departments to really try and make housing work, it would not have been possible. And, last but not least, like Donna touched on, we are truly honored to be working in collaboration with the county and mental health court in developing this women's wellness house. During, I'm not sure how we ended there. I think that, we run good housing. We've seen a lot of success with our individuals. A lot of our individuals really do move on to seek independent housing. They really do learn the skills. They have improved quality of life. They have employment. They're able to get their own apartment. And for those that don't, we've been able to transition them along in our program in a less restrictive environment, affordable, still having staff support at different levels. So this women's wellness house, the idea of being able to get involved in any kind of diversion, mental health court, we found that we had a lot of admissions during the pandemic from the forensic system, because although much of the world shut down, unfortunately, people were still homeless and people were still incarcerated and needed somewhere to go. So we never froze our beds. So a lot of the individuals that we started taking during the pandemic were the forensic population. So I hope that there is trust in Comans that we're going to be able to effectively run this women's wellness house. We're very excited about it. It's the block grant funding, and then we, after we had found out, we purchased a property. We are renovating the property. We had an anonymous donor provide a generous sum of money towards our first year of operating funds, which is going to be amazing. And we are just really excited to delve into this. And I think also worth noting is that it's a beautiful farmhouse built in 1860, which to me just fits in, at least what Bucks County used to be back in the good old days. And I just think it's going to be just a place. To me, it already alludes wellness in the warmth and home style atmosphere of it, the hardwood floors, the woodwork and everything. And we're really excited to help these women, get back on their feet and rebuild their lives and become productive, happy individuals who are going to stay out of the criminal justice system. That's the goal. So yeah, I'm open to any questions. That's what Comans does in a nutshell. But if there's any questions anyone has, I'm happy to answer them. Thank you for listening to me and being patient for when you couldn't hear me.
And I will just say that the Women's Wellness House is going to be located in the lower end of the county.
Yes, Langhorne.
Great. Thanks for coming and joining us, Beth Ann, and presenting about Comans. I think a couple years ago, we thought it would be a good idea to have additional partner agencies come through and share out how they partner with us and how they utilize block grant funding. So thank you for coming and providing perspective from COMANS. I think we are excited for the launch of the Women's Wellness House.
Thank you.
Okay. All right, so in terms of the presentations, that concludes what we wanted to share with you this afternoon. I did want to note, we're going to allow for public comments right now, and please be aware that we are recording this block grant presentation. It's one of the requirements for the application, so we're recording this hearing. And at this time, I wanted to invite anyone to share out comments. We can start with anyone who's in the room. And then if you're online, feel free, you can let Shannon know in the chat you'd like to speak, and you have the ability, I believe, Shannon and Matt, to unmute yourself and ask a question. Okay, great. So first of all, thank you, Donna, Diane, Aaron, and Beth Ann for presenting today. It was a lot of information, so thank you. Any comments or questions? Okay, online participants, no one in the audience here is sharing anything, so we're happy to move online if there's anything anyone would like to share. Great. Okay, so the block grant, as I shared at the beginning, we're required to have 2 hearings. So we have our second one on June 1st. Is it at 10 a.m., I believe? And it's virtual. And again, that's publicly available to anyone who wants to participate. So again, if there are no comments or questions for the panelists today, which is absolutely fine, we will go ahead and close out the hearing. Okay, we have one comment in the back. Is it Mr. Greer? Yeah. Hi. Great. We will bring you a mic. Hang on one moment. Thank you.
Thank you, and good afternoon, and thank you for the presentation. My name is John Greer. I'm the Executive Director of the Bucks County Association for Retired and Senior Citizens, and we oversee 4 of the 13 senior centers in Bucks County. And unfortunately, trying to locate how to get here and parking, I missed the beginning of your presentation. So I was just wondering, is this online somewhere that I can pick this presentation up?
Yes. So it's good to see you, Mr. Greer. Thanks for coming. And this hearing will be posted on our website. So it will be uploaded to the Human Services website, and it will be available for the public to view.
Thank you. Thank
Yep.
you very much. Appreciate that.
Absolutely. And on one of the opening slides, there were email addresses available if people wanted to submit any public comment, and it was to stkirby@buckscounty.org or rneff@buckscounty.org. So that's Shannon Kirby or myself, where you can submit any kind of comments or questions. So we'll leave that slide up for another minute or 2. All right, well, thank you everyone for coming out this afternoon. It was good to see you, and have a good rest of your day.